How do breast reconstruction options work after a mastectomy? Imagine turning a challenging moment into a step toward feeling whole again. After a mastectomy, which involves removing breast tissue to treat or prevent breast cancer, many women choose to rebuild their breast. This process is called breast reconstruction and aims to restore the breast's shape and appearance, helping women regain confidence and a sense of normalcy. The options for reconstruction mainly fall into two categories: implant-based and autologous tissue reconstruction. Implant-based reconstruction uses artificial implants filled with saline or silicone gel. These implants are shaped to resemble a natural breast. The procedure can be done in one step, called direct-to-implant, or in multiple stages. Often, surgeons start with a tissue expander, which is a temporary device placed under the skin and muscle. Over several weeks, the expander is gradually filled with saline to stretch the skin and create space for the final implant. Once the skin has stretched enough, a second surgery is performed to replace the expander with the permanent implant. Implant reconstruction is generally less invasive, with shorter surgery and recovery times. However, it may require future surgeries to replace or adjust the implants and can sometimes lead to complications like capsular contracture, where scar tissue tightens around the implant. Autologous tissue reconstruction involves using the patient's own tissue from another part of the body, such as the abdomen, back, or thighs. The most common techniques include the tram flap, which uses abdominal muscle and tissue, and the deep flap, which uses skin and fat from the abdomen but spares the muscles. The latissimus dorsi flap uses tissue from the upper back. These methods create a more natural feel and appearance because they use real tissue. They tend to last longer without needing replacement but involve more complex surgery and longer recovery times. Because tissue is taken from another part of the body, there are additional considerations, such as the healing of the donor site. Timing of reconstruction is also important. Some women opt for immediate reconstruction, which happens during the same surgery as the mastectomy. This can reduce the number of surgeries needed and may improve emotional well-being. Others choose delayed reconstruction, which takes place months or even years later, often after completing other cancer treatments like chemotherapy or radiation. There is also a delayed immediate approach, where a temporary tissue expander is placed during mastectomy, and the final reconstruction is done later. Additional procedures can help restore the breast's appearance further. Nipple and areola reconstruction can be performed months after the main surgery. Sometimes, surgery on the opposite breast is done to create symmetry through augmentation, reduction, or lifting. Every person's situation is unique. Factors like overall health, smoking, obesity, or prior radiation therapy can influence which options are best. Reconstruction does not interfere with ongoing cancer treatments or detection but may affect how mammograms are performed. Sometimes, fat grafting, which involves transferring fat from one part of the body to the breast, is used to improve contour and shape, but it requires careful monitoring due to the possibility of fat absorption or lump formation. Choosing the right breast reconstruction approach is a highly personal decision. It involves a team of healthcare professionals, including surgical oncologists, plastic surgeons, and rehabilitation specialists, who work together to develop a plan tailored to each individual. Consulting with these specialists can help ensure the best outcome based on your medical condition, preferences, and lifestyle. Remember, every woman's journey is different, and the goal is to help you feel confident and comfortable in your body again.